Good morning. Thank you for attending today's press conference. My name is Eric Cortez and I serve as the Assistant Medical Director for the City of Columbus Division of Fire. Today marks a special day for emergency medical services in Columbus as we prepare to launch the Mobile Stroke Treatment Unit. I am joined by several leaders from our healthcare systems and city officials to discuss the Mobile Stroke Treatment Unit. Please welcome our first speaker, Councilmember Mitchell Brown.
Thank you, Dr. Cortez. Good morning and welcome to Fire Station number 3, also known as the Mitchell J. Brown Fire Station. Now, I have to tell you, I don't know who that is, by the way. But this station was completed in 2015, and in collaboration with members of the Fire Division, this station was designed to include space for the Fire Division's bomb squad, K-9 unit, and dive team. Please take a few moments at the end of this event to tour the station. It's a very, very special facility. This year marks the 50th anniversary of the Heartmobile, launched as part of a study to determine whether on-site help for heart attack victims would improve survival rates. The Heartmobile, a redesigned mobile home, customized with emergency room equipment, revolutionized treatment for heart attack victims by providing on-site pre-hospital emergency care. It was the precursor to emergency vehicles of today. Originally staffed by physicians from The Ohio State University Medical Center, the Columbus firefighters were trained as paramedics to ultimately replace the physicians. Today, each of the Columbus 34 fire stations, soon to be 35, are staffed by paramedics. Just like the Heartmobile changed the way pre-hospital treatment for heart attack victims was initiated, I envision a future where the mobile stroke unit revolutionizes the methodology of pre-hospital stroke treatment in the same way. Today's announcement has the potential to reimagine the way our community views strokes. Before, where there was a loss of limitation and there was no hope for time, more time for family and friends, hope for more active, fulfilling life. This project, a first-of-its-kind collaboration between the OhioHealth, Carmel Health Systems, the Ohio State Wexner Medical Center, and the Columbus Division of Fire, has been 5 years in the making. The Columbus community will be joining 15 other communities across the country with the pilot launch of our mobile stroke treatment unit. Stroke is the disease that affects the arteries leading to the brain. It is the #1 cause of people becoming permanently disabled. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or ruptures. When that happens, part of the brain cannot get the blood and oxygen it needs, resulting in death of brain cells. There are an estimated 17 million strokes worldwide each year. In 2018, our EMS units responded to over 833 impression stroke runs. But strokes are treatable. The stroke mobile will be able to respond and treat both non-bleeding and bleeding strokes. The unit will be staffed by 2 Columbus Division fire paramedics, a CT technologist, a nurse practitioner, and physician assistant, with patient treatment being overseen by an OhioHealth physician. The onboard computerized tomography CT scan machine will allow the type of stroke a patient has experienced, bleeding or non-bleeding, to be identified and has been advanced capability to send the results to a physician managing the patient's care, which will allow the appropriate immediate treatment to be administered on the spot. Patients will no longer have to be transported to an emergency room before treatment of the stroke is administered. The concept of the stroke mobile is bringing definitive care to the patient, not the patient to the care. It has been proven, as with the Heartmobile, pre-hospital emergency care is crucial in the recovery of patients. Every minute treatment is delayed can result in a minimum of 1 week of rehabilitative services for a stroke victim. Once patients have been treated, they will be transported to one of 3 certified stroke care centers in Columbus: the Ohio State Wexner Medical Center, Riverside Hospital, or Mount Carmel East Hospital. The cost of this mobile unit is approximately $1 million and has been underwritten by OhioHealth. Among other things, this state-of-the-art unit offers video monitoring system that will allow the OhioHealth physician to initiate treatment remotely in real time. The unit will operate 7 days a week from 7 a.m. to 7 p.m. I'd like to thank the project manager, Mr. Nate Jennings, OhioHealth Fiscal Officer Debbie Graves, and Dr. Bj Hicks, co-director of the OhioHealth Comprehensive Stroke Center at Riverside Methodist Hospital, and the leadership at OhioHealth for their generous financial and operational support. I also want to thank Dr. Cortez, the medical liaison for Mount Carmel Systems, and our partners, of course, at the Ohio State Wexner Medical Center for their leadership. Once again, the Columbus way, the way of people coming together collaboratively to address an issue, has resulted in the city of Columbus becoming a trailblazer in the treatment of stroke patients. Thank you again to all of our partners, and at this time, I'd like to introduce Dr. Bj Hicks.
Wow. I never thought this day would come at times, so I'm giddy to be here. Let me start there. Can we please give Councilman Brown some more kudos for that amazing breakdown of what we're doing. I don't know if there's much else to add there. He was so succinct and very thorough about what we're doing here. I was asked to talk about the experience and kind of where this all came from. I will try to be limited in my time because this is something that's very near and dear to my heart, so I could take the rest of your day, so I will try not to do that. But at any rate, when I was in training for stroke, this came out in Germany, something like this, a mobile stroke treatment unit for patients in Germany. And when I was in training, I looked to my colleagues and we all said, this has to come to the United States. This is the future of stroke. I left, joined OhioHealth, and lo and behold, a few years later, where I was, became the first place in the United States to have one in Houston, Texas. And I remember at that moment, as soon as it was officially announced, I did one thing. I told my bosses at OhioHealth, I said, this is the future of stroke. And instead of patting me on the head and saying, yeah, that sounds neat, they said, how can we do it? Is it feasible in Columbus? Let's think about this. Let's talk about this. And that lit a match in me and lit a match in the health system. And as they say, the rest is history. We secured funds several years ago, but this had to be socialized well within our town. This had to be something that required all members of all stroke programs across this great city to ensure that all members of the community are going to get the best care at the right time regarding their possible stroke. And that's what this is all about. And the Columbus Way was mentioned, and I think this is a great example of that. Eventually, after looking at what was done in Houston, the second one in the country was in Cleveland Clinic. Coincidentally, my mentor runs that one as well. So we spent a lot of time in Cleveland looking at how they do. And throughout the years of working in partnership with Columbus Fire, Mount Carmel, the Wexner Medical Center, and ourselves, figuring out how best to do this for our town, we learned the do's and don'ts from the other places that may not have had the smoothest of starts. So we are very confident that our unit will do it the right way. So again, you've heard more about kind of the logistics, but I will speak a little bit about how the process kicks off and how it starts. The great quote about bringing stroke care to the patient is what this is all about. And we have not done a very good job in the world of stroke about rapid treatment. The treatment options for stroke are extremely time dependent. It's not just a matter of whether or not you get the treatment. And sadly, a small percentage of patients actually get this treatment. So this is going to work proactively to make sure that the patient is getting this treatment as soon as humanly possible. So when a 911 call comes out, those that are working on the mobile stroke unit will hear that call as well as the local medic. And it's going to be a parallel process trying to meet at the bedside, trying to meet at the patient. And you want to get there as soon as humanly possible. You want to hear briefly what the situation is. And if this truly is a stroke, then there's going to be a handoff process where the patient is now going to enter in the mobile stroke treatment unit, the logistics of which you'll hear about later on in this conference. But while the patient is assessed, it's being done right then and there, right where the patient resides and where the stroke may have occurred. And that really presses the fast forward button on their care, because you're being seen by an advanced practice provider who is stroke trained right there at the bedside. We have the CT techs, we have the ability to draw labs, we have the ability to look at the CAT scan in real time, because the stroke doctors like myself, they are notified as soon as possible, and they're able to assess the patient as well via telemedicine technology, which you'll hear more about, and you'll be able to discern whether or not a clot busting treatment is needed, or a bleeding reversal medicine is needed, or if the patient is actually having a seizure and seizure medicines are needed, or other medical emergencies and neurological emergencies which are required at the time. And then eventually, once that is quickly discerned, then the patient is taken to the nearest comprehensive stroke center, which is something that we're going to be very proud about. We're going to be watching very closely amongst our individual committees, where we meet routinely to discuss all of the care and all of the outcomes of these great patients. So again, I can talk more and more about this. I'd be more than happy to field any other questions at a later date. But again, at this point, I'd like to pass this off to Dr. Richard Streck with Mount Carmel Health System to discuss a little bit more.
So I am absolutely thrilled to be here today, and I think one of the things I haven't shared with my clinical colleagues is years ago my mother suffered a devastating stroke that left her with a major speech deficit for the rest of her life. Now, being my mom, she also found ways of scolding and cajoling me despite that deficit, but it is important that we have evolved our care to the point where we can actually intercede quickly, effectively, and actually reverse some of the horrible sequelae of stroke. So I think it's appropriate in this month of stroke awareness just to remind everyone in this audience of our BFAST acronym, and that basically stands for those symptoms and signs that are indicative of a stroke in process. And there are things like changes in your balance, sudden changes in balance, visual problems, either in one or in both eyes, so that's the E for eyes. The facial droop is a sign of stroke. Weakness of an arm or a leg is a sign of a stroke, as well as speech deficits like my mother manifested. The last letter in the BFAST stands for time, and we've come to realize that time means brain. And so it's time to call 911 if you have any of these signs or symptoms moving forward. So how's that mobile stroke unit differ from an ambulance? I think you've heard from Dr. Hicks that it's a very specialized unit with very specialized people on board. So we have an advanced practice nurse or practitioner who is specially trained in stroke care. There's a CT technician on board. There's also a paramedic. All of these folks are supported by rapid CT in the unit as well as point of care testing. That allows them to distinguish between the three major types of strokes that Dr. Hicks talked about. And that's important because the time to treatment is critical, and the treatment for each of these types of strokes is very, very different. So I am absolutely delighted to be here. I'm more proud of this community than in any other community I've lived in. The cooperation between the major health systems and the city of Columbus has been phenomenal as we've evolved this program, and I look forward to much more productive, safe, and effective care for our stroke patients in the community. So at this time, I'm going to turn it over to Dr. Vivian Lee. And Dr. Lee is the director of the Wexner Medical Center's Comprehensive Stroke Center. Thank you.
Thank you. It's my honor to be here today. Stroke is the 5th cause of death and the leading cause of disability in the U.S. With more than 6,000 Central Ohioans having a stroke each year, improvement in stroke treatment is needed. The Mobile Stroke Treatment Unit allows the emergency department to be ready for the next step. After the patient arrives to the ED, they can be moved to the next phase. This allows the hospital team to have a head start, which can allow stroke treatment to be initiated earlier. The process includes pre-notification to the ER, which allows the hospital team to know the clinical history and imaging results prior to arrival to the ER. This will allow speedier times to quality benchmarks, including time to assessment and time to intervention and treatment, which in turn will help improve outcomes for stroke patients. Next, I'd like to introduce the next speaker, Columbus Fire Deputy Chief Sean Kozar. Thank you.
Well, how do I follow up all those great remarks? Good morning. Welcome. My name is Deputy Chief Sean Kozar, and on behalf of Fire Chief Kevin O'Connor and the men and women of the Columbus Division of Fire, we'd like to welcome you today to basically history in the making, right? We're all here to celebrate the next chapter in the delivery of pre-hospital care to the citizens of Central Ohio. I'd like to start by recognizing that this could not be possible without the support of our city leadership, Councilmember Mitchell Brown and Director Dr. Ned Pettis Jr. Were instrumental in backing this, as they do so many of our endeavors, and we couldn't be more appreciative of that support. As mentioned, 50 years ago, a collaboration between Columbus Division of Fire and The Ohio State University led to the Heartmobile. That paved the way to EMS system that we have today, and that took teamwork. And that quality care continues in the teamwork that we have here in this endeavor. How this truck is going to work is it will be dispatched on the call once received in our 911 center, our fire alarm office, along with the closest companies. That'll be a medic unit, a standard medic unit that's at every firehouse that we have now, the closest ALS engine company, and the EMS supervisor. Those crews will arrive on the scene and assess the patient. They will then find out how close the stroke truck is. And keep in mind that the stroke truck, having been dispatched to the scene, will have a good head start of 4 to 6 minutes prior to arrival of the other crews, and be that much closer. If it's within a certain set period of time, the crews will stabilize the patient, start the normal ALS procedures that we will have done, and move the patient to their vehicle and await the stroke truck's arrival. In that situation, they will turn over care to the definitive care, just like they would in a hospital. So it's not transferring care to another vehicle, it's like transferring care to the hospital in the street. The service hours will be 7 days a week from 7 a.m. to 7 p.m. Why that time? It's because of several reasons. Number one, we found that through research that most of the stroke data shows that that's when strokes occur. You typically don't wake up or have one during the night. You wake up in the morning either having had one, or shortly after you wake, sometime in the early afternoon, the symptoms present themselves. Also, this sets a 12-hour period that we will have the truck in service and 12 hours that we won't, so that we can compare those two periods of time. Also, this time coordinates with the start times of our hospital partners. Initially, it will just respond in the areas that Columbus Fire dispatches to, but in the future, if we find that we're able to support the municipalities around Central Ohio, it could expand its reach there. Bringing this care to the streets and to the people's driveway shaves potentially valuable minutes off the time to treatment, and then in turn, months of rehabilitation and recovery. This could potentially result in millions of healthcare dollars saved for our community. So in closing, we couldn't be more proud as the Columbus Division of Fire to be participating in this partnership with our healthcare systems here in Central Ohio. And we look forward to continuing to pave the way for excellent pre-hospital care as we've done for the last 50 years now and into the future. I'll turn this back over to Dr. Cortez for some closing remarks.
Thank you, Chief Kozar. This concludes our press conference for this morning. Representatives from our organizations will be available for questions and one-on-one conversations immediately following. Thank you and have a nice day.